Join the conversation.
You're with Cape Talk.
We've got the naked scientist. We got Dr. Chris Smith. Are you there?
Morning. How are you?
Well, we've got sunshine today. We've got sunshine this weekend as well. High of 19 degrees.
28 degrees. 28 degrees. I'm going to be going and making some vitamin D. Talking of temperature, I had a really fascinating week this week. So I went along a couple of days ago to the British Antarctic Survey, and they're based outside of Cambridge at near Madingley. And they have just taken delivery of the oldest ice cores ever drilled from Antarctica. So they've gone down nearly 3 kilometres into the ice, drilling these cores, and they've got down nearly to the bedrock, which is the continent of Antarctica. And the ice that's come up from there is about 1 million years old. And they've got it in crates in this freezer. I went in this giant freezer, and there are these enormous polystyrene cooler boxes, like you would take your beers to the beach in, if you weren't having the kind of day you're having.
It's illegal.
And in there are these plastic bags with these drain pipe sized cores of ice, beautifully clear. They're like glass because they've been so highly compressed by the massive weight of water above that all the air bubbles and that kind of thing have been squeezed down. And that is literally 1 million years old. So I'm looking at snow that fell 1 million years ago. Now, why they're interested in all this is that there are pockets of gas trapped in there, which it will be possible to analyse, but also there are chemicals in the and forms of the molecules, isotopes, which are dictated in terms of their proportions by what the climate was doing at the time. So this will give us a unique snapshot back further than we've ever seen before in the ice record, which we can then compare with other records independently, things like coral clocks and ocean clocks and so on, to try to work out what the climate was doing in relation to what else was in the atmosphere at that time, to have a better understanding of why climate goes through cycles of warming and cooling, and why there appears to have been a change in the way that happens from 1 million years ago or so. It used to happen, swing around quite frequently, and then the time at which it does that just changed, and we have no idea about that. So it'd be really, really useful to have insights. But it was pretty amazing to be staring at something which other people have barely ever seen, but also is 1 million years old. Snow that fell 1 million years ago.
Well, I think let's start with Dane's question. It's temperature related, but it does relate to air conditioning. He wants to know, does putting the air conditioning on very hot or very cold actually make you ill? I've always wondered about that.
Well, no, I mean, it doesn't, because human beings are incredibly resilient, and most animals that survive on Earth are incredibly resilient. That's why they're still here, and biology hasn't selected them out. We are really very good at controlling our internal environment, regardless of what the external environment's doing. Obviously, there are limits, and if you become too hot, you're not going to survive. And if you become too cold for too long, you're not going to survive. But we have excellent coping mechanisms. So if we experience a particular temperature, we will adjust accordingly. Our body will adjust and our behaviour will adjust. There's no evidence that if you breathe cold air, this is going to give you a cold or going to give you the flu or something. Similarly, if you breathe hot air, within limits, this is not going to do you any harm because your body will just compensate. It might, in the long run, affect your risk of getting things like dry eyes, dry mouth, dry nose, and that might make you more vulnerable to infections. Similarly with very, very cold air for prolonged periods of time. But what comes out of your aircon unit, the temperature range that's capable of producing is probably not going to do any harm to your health, at least in the short term.
Mag Mini wants to know about mental illness. At what point does the body reach a breaking point? What factors contribute to mental illness and body shutting down?
Well, first of all, this is very, very common. If we take a person off the street and do various tests on them, we can find that about 1 person in 5 at any moment in time is in a low mood and feeling depressed. And so mental illness, very, very common. But most people, thankfully, do not suffer this chronically. chronic mental stress, distress, illness, anxiety, where it's to the point of being disabling, where you can't go about your normal business, that's thankfully much less common. And probably about 1% of people are actually in that position where they're disabled to the extent that they really need more help than just taking a day off and gathering their thoughts and looking on the bright side and rationalising. Why does this happen, though? Well, we don't know exactly why people become mentally unwell and how that then affects the body, but it clearly does. Because if you look at people who are suffering from mental ill health, it also goes hand in hand with physical ill health. And there's a range of reasons why that might be. People who are feeling low or having other mental problems don't sleep very well. Sleep is key to our health in many, many respects. So it disrupts sleep. It also tends to disrupt appetite. So people who are feeling unwell mentally don't feed themselves properly. They may eat lots of the wrong foods and lots of high-calorie, sugary foods to try to give themselves a mood boost, and that's very bad for you. It can cause weight gain and high sugar levels and a risk for diabetes. They may also eat lots of fatty foods. One other common mental ill health is eating disorders. People may develop anorexia or bulimia. This is also extremely bad, and it surprises people when I tell them that in fact, the mental disease, the mental ill health problem that has the highest rate of mortality attached to it is anorexia. And it accounts for more loss of life than almost any other mental problem. So there are many ways in which these things can have a mental origin, but a physical manifestation. And they're probably multifactorial. All of the above apply. We don't go out so much, we don't socialise so much, we don't feed ourselves properly, we don't sleep properly. All these things will erode physical health. And if your physical health suffers, your mental health suffers. So it becomes a vicious cycle. And that's why we try and break that cycle by helping people to think about things in a slightly different way, think about their whole health, and also, whatever they do, make sure they get on with life, because occupational therapy, being occupied, doing things, feeling that you're contributing is enormously important to our well-being, and that makes us feel better, and that often equips us better to deal with life's knocks. So the worst thing people can do when they're feeling down is to retreat from society, retreat from life, and ruminate about it, because that will make you worse, not better.
Okay, a question in from 4 different people. So, I'm anticipating more. So let's tick these 4 questions off in one go. Let's read Vernon's question. What is your contract status? You were going to update us this week.
Right. I'm pleased to say that I'm going to be able to make an announcement next week about this. So on Wednesday next week, I'm going to be holding Naked Night. I'm going to do a big Zoom call for people all around the world, and we're going to talk about what's happening, what has happened, and what we're going to do about it. Where you can find out details of that, we'll put on the Naked Scientist website, on our social media channels. You can follow us on X at Naked Scientist. You can find us on Instagram. But also, I will put a podcast episode out with details of where you can join the feed. I'll also have a webpage, nakedscientist.com/SOS is the one we've been using, but we'll update that, and we'll have a get-together on Wednesday next week and set out what we're going to do and how we're going to take things forward. I can't say anything more before that because I'm still waiting for a few more details, but I think that's going to be the day, Wednesday evening, and I'll give precise details via the above channels I just mentioned. So nakedscientist.com/SOS, keep an eye on that page. We'll do this on Wednesday next week, and then everyone will understand, and we'll all be able to get together. Everyone will be able to see each other as well, because there's a big audience all around the world behind this, and it'd be lovely to actually meet up and have a nice social. And we're going to start doing this as a regular thing. Once a month, we're going to have Naked Night. So are you going to come?
I'm definitely going to come.
Right, okay. See you at Naked Night next Wednesday.
A lot of us are going to be there on Naked Night. Now, Jill wants to know, how do you reduce puffiness under the eyes, and what causes this?
Well, when skin swells up, and there was actually a picture in the newspapers around the world yesterday of Donald Trump's ankles and hands, because he's got some puffiness. And when we have puffy skin, usually that puffiness is liquid, fluid, and it's called edema. And where it comes from is that blood in our blood vessels is under pressure, and it flows into tissues and goes into fine blood vessels called capillaries, which are leaky. And the water in the blood, because it's under pressure, is pushed out through the leaky capillaries into the tissue. And what opposes that happening is that there are proteins in the blood and salts stuck to those proteins, which exert an osmotic effect that pulls water back into the blood vessels. And at the vein end of the blood vessel, the pressure is very low, and that helps to push fluid back into the blood vessel as well. So as a result, you are in an equilibrium where there's water leaving blood vessels into tissues and then going back into blood vessels. If you get puffiness, it's because more water has left the blood vessel than should have done. And this can happen for a range of reasons. It can happen because that protein that's in the blood and can't get out that I mentioned is at too low a level. And people who are undernourished or are losing protein in their urine, for example, this means the blood can't suck enough water back in out of the tissues, so you will end up with puffiness. And this can happen all over the body, but it tends to happen most in the so-called dependent parts of the body, places where you're dangling your legs over the edge of the seat, around your ankles, your arms are dangling down. The other reason why you can get puffiness is if blood vessels become more leaky in the first place. Now, why should this happen? Well, when we stand up, we have the benefits of gravity pulling water downwards. And so it pulls water out of your head down towards your feet. And that's why people's ankles on a hot day might get a bit puffier. If you're on a long airplane journey because you're not moving around, the water can accumulate there and they get a bit puffier. When we lie down at night, though, we don't have the gravity pulling the water down out of our head. So it tends to have a higher likelihood of accumulating around your eyes and face. And this goes away when you get up and stand up. So if you've spent a long time lying down, or you've been an astronaut in space where there is no up and down, remember you're in free fall in space, and that's why astronauts tend to get bloaty heads. Their heads swell up because the water moves more preferentially around their face. That's the reason.
Linda with a question. Morning, Naked Scientist. Is it really possible that this very cold weather can make old operation sites sore again? Sites that had previously healed? And if so, why is that? I had a big lung operation 8 months ago, and the pain had virtually gone 6 months later. But when we started getting this cold weather in winter, the pain got worse. The lung x-ray was good. Thank you, Linda.
Hi, Linda. Well, there's a couple of possible explanations for this. First and foremost is that when you've had bad weather, you tend to do less because people feel less inclined to get out and about. Weather's cold, it might be rainy, and you don't want to do so much. Physical activity is really important for keeping us feeling well and also being in good health. So if you don't want to go out so much, you tend to do less. And if you do less, you tend to end up with more aches and pains and stiffness. So it might be that part of it is less physical activity because when the weather's bad, it makes you want to do less. The other possibility, and they're not mutually exclusive, it may be that more than one thing's going on, but the other possibility is when we do major surgery or we have major trauma, we do interrupt and cut through lots of nerves. And when the tissue heals and nerves grow back, there can be a period of miswiring where nerves that normally convey one type of sensation, such as pain and temperature, those nerve signals which communicate into the spinal cord can be driven by other kinds of nerves that would normally pick up on other sorts of sensations, such as the wind brushing across your skin or your fingers tickling your arm. Those lower input, lower mechano-stressful type stimuli. So one possibility is that the cold weather is driving some of the nerve circuits that would normally be sensitive to pain and temperature more and activating pathways to a greater extent than it would do normally because there's been an element of injury to the nervous system, a bit of miswiring, and the nerve wiring hasn't completely reset itself yet. So it could be that that is also part of the reason why areas where you have had surgery then feel different in the aftermath across different ranges of sensations and temperatures and so on. So it could be that, or it could be the fact that we're physically less active when the weather's bad. And as a result of being physically less active, we tend to notice and dwell on things that are uncomfortable for us because we've got nothing else to distract us.
Okay, let's go to Linda's question. Hello, please ask Dr. Chris about the side effects of statins.
Statins are drugs that lower cholesterol, and they do it by inhibiting a molecule called HMG-CoA reductase, which makes cholesterol in the body. And if you inhibit that, you cannot make cholesterol to the same extent that you did before. And if you have a tendency towards high blood cholesterol, we know that higher levels of one form of cholesterol, the low density form, LDL cholesterol, this is a risk factor for heart disease, vascular disease and stroke. So if you have a high level of that, taking a statin can reduce the level, and this reduces your risk of your blood vessels furring up and then developing the aforementioned conditions. Now, with low cholesterol, there is the possibility, some people have claimed, that this can, because the brain forms connections between nerve cells, and those connections are stabilized by inserting cholesterol molecules into the membranes of nerve cells. There is one claim that long-term statin use can affect the way in which you're able to remember things. It may affect memory. It may therefore be a risk factor for dementia, people say. But then having vascular disease is a risk factor for dementia. So life is a balancing act, and whilst we don't know for sure, because we're still doing long-term studies on these things, we know that the risk of vascular disease and the benefits you get from taking statins are far greater than any theoretical risk to the nervous system. But some people have said that they have felt it's harder to remember things in the same way as they did before they were taking statins, but then they're a bit older, aren't they? So that's one possibility. The other thing that people often say with statins is it gives you aches and pains. People would often say, I had to stop taking them. The aches and pains were so intolerable, I had to stop them. Actually, this was done as a formal study in a number of settings where people were given statins or they were given a placebo, and they were asked about this side effect, and they found there was no difference in the rate at which people reported aches and pains on statins versus placebos. So we think this is an example of what they call the nocebo effect, where if you tell people they might experience a side effect that's negative, people more often report that side effect just because you've told them to expect it. So there's not really any good evidence that statins cause muscle aches and pains. We think that that is basically a nocebo effect.
Dr. Chris Smith, we want to squeeze in this voice note and hopefully squeeze in an answer as well. Let's take a listen, Joe.
A question for the naked scientist. Why is it that babies wake up and they can go from being woken asleep and literally leap out of their beds, whereas adults need time to come to and wake up?
Because we've been up all night worrying about the babies. That's why. Yeah, I mean, I know what she's saying, but I think part of it is that when an alarm clock goes off, if it's a fire alarm or something, you can leap out of bed and scurry out and just act on impulse, can't you? And when children first wake up and they act on impulse, they'll be up and about and doing things. That when we've been up half the night worrying about life in general, and we're probably a bit sleep deprived anyway, and we don't have to suddenly act on instinct, we do think, oh, I feel a bit sluggish this morning. And until you've had that first cup of coffee, you do tend to be on a bit of a go slow. So I think it's more a symptom of the fact that kids have a cushy number and an easy life, and us adults don't, because we're doing work, doing other things and looking after them. Therefore, we're a bit tireder to start with, and we're older. So I think we can play the age card here.
Yeah, indeed. We're going to have to wrap it there. Dr. Chris Smith, lecturer at the University of Cambridge, and of course our weekly dose of Naked Scientist right here on Cape Talk.
Join the conversation.
You're with Cape Talk.